Hello everybody and welcome to today's PB Upskills. My name is Amanda Pawley and I am Deputy Editor at Professional Beauty. Today we're going to be talking all about treating hyperpigmentation on different skin types. So we're going to be covering the different types, why it occurs, symptoms, common causes, and how you can effectively treat the condition for clients in salon when you reopen. Now today our lovely panel includes skincare experts from the Skin Collaborative, which is a new online platform that aims to educate the general public on their skin and the best way to care for it, with a focus on the best people to do that is a beauty professional. So they're brand new. You can read about them on our website, or if you go onto their Instagram and put in the Skin Collaborative, you can find out a bit more about them there. Just before I get the panel to introduce themselves, just going to do a little bit of housekeeping with you guys. If you do have any questions while you are watching this, just pop them in the comment box on Facebook or in the chat box on Zoom, and we will get the panel to answer the questions for you at the end. There's no silly questions. You can ask what you want. And we really do encourage it because, you know, these guys have such a wealth of knowledge. So thank you everybody for joining us today. How are you all?
Well, good, thank you. Thank you for having us.
Well, thank you.
Yeah, thank you for joining us today. So I just thought maybe you guys could go around and introduce yourselves. Maybe we'll start with Raquel, then Maria, and then Sarah.
Cool.
Hi, I'm Raquel, part of the Skin Collaborative, and I do have a clinic in Kent called Dr. Raquel Skin and Medical Cosmetics. Love skin, and that's why I decided to join the Skin Collaborative and help to educate the public about it.
Great, thank you.
My name's Maria Rylott-Byrd, again, part of the Skin Collaborative. I have a skin clinic in Buckingham where I specialise in skin health and transformation. I love skin, all things skin. I specialise in skin. I take a corneotherapeutic approach, skin health first in everything I do.
Brilliant, thank you, Maria.
Yeah, I'm Sarah. I am the founder and an advanced facial practitioner at Sarah Hurst Skin Clinic, which is based down in Brighton. I have over 30 years of experience in the beauty and skin industry, and skin is definitely my passion, as is my team's as well. And we just love educating people in sort of the whole 360 approach to sorting skin out and actually making sure the public is educated in making sure that obviously it is really important to actually see a skin professional rather than cherry picking off the shelves.
Brilliant, thank you so much, guys. So yeah, as you can see, we've got an absolute panel of experts with us today. So obviously today we're going to be talking about hyperpigmentation. Could you tell us a little bit about what the skin condition is and why it occurs? Maybe we'll start with Maria first.
Okay, well, hyperpigmentation is a term used to describe discoloration on the skin or abnormal darkening of the skin. So we all produce pigment. Indeed, that's what gives us our different colours, individual colours. So what you will see on the skin, and also that protects us against UV radiation as well, for its main function. So, but with persistent triggers, what tends to happen is you get an overproduction of melanin from the melanocytes. And then that travels its way up to the surface of the skin, and that's where you see that discoloration in a nutshell.
And Raquel and Sarah, do you guys have anything to add to that?
No, I think Maria said it beautifully. That's exactly it. We just, it's an excessive production of the melanin, and there are other factors, lots of factors that can contribute to that, which I'm sure we're going to be touching upon. But I know a lot of people, you know, they hate pigmentation, but it's actually a way of our body to protect us ourselves, like Maria said, from damaging the DNA and the RNA of our cells. So in a nutshell, it's actually a good thing and not a bad thing.
The only thing I'd like to add there is actually it's absolutely a massive concern with our clients generally. I think it's one of the most common things that people come and consult us about is hyperpigmentation. It's a massive global concern with all skin types and all Fitzpatrick skin types from 1 to 6. And actually, hyperpigmentation can present itself, especially as we get older, in about 90% of the population.
I think it's really interesting that you guys say it's quite a big issue with clients, because I do feel like it's been spoken a lot more in the past few years. Do you think one of the issues is that necessarily hyperpigmentation isn't normalized in kind of media campaign imagery and things like that? Do you think that's one of the reasons why people maybe have an issue with having hyperpigmentation?
I think that goes for everything across the board. I think we're sold an imagery that perfection does exist. And that's something we're very, very passionate about in the Skin Collaborative, actually, and promoting real skin. So I think it's really about making people aware that these concerns are normal, they're prevalent in all communities, and that there are ways to help, but certainly not to discourage people by promoting perfection. I think showing them what's real and explaining how to treat it properly is the way forward.
Yeah, definitely.
I agree. I think it has a massive effect on people's psychological, you know, sort of life in general. It has a major effect on confidence, and it can really lead to a decrease in quality of life for some people, you know. And as Maria already explained, you know, the fact that there's such this imagery out there of perfection with filters, and we talked about this with the Skin Collab only last week in regards to International Women's Day, and this whole imagery of using filters and not using filters, and really trying to persuade people just to actually show themselves and not to hide behind filters. Because I think that's the problem, isn't it? All these things, when we see perfectionism and then actually somebody has a condition like hyperpigmentation, it really does affect the quality of their life.
Yeah, and it has a massive impact on mental health. And I think we need to talk about it more and more and more. And we do see a lot of patients that have hyperpigmentation coming from already stressed mental health, because it's one of the things we're going to be talking about is associated with acne, is associated with pregnancy. And we know it's already a delicate phase, and then having those filters and all of that social media, you know, showing up perfection is just has even a bigger impact on mental health. And we really do need to, you know, to think about these things, not only for the younger generation, the teenagers, they're always on Instagram, but also the older generation that's starting, you know, to see these signs, because we see a more prevalence of this pigmentation as we grow older as well.
Yeah, definitely. Really interesting. And how does hyperpigmentation appear on the skin, and can it appear differently on different skin types?
Yes.
Who would like to go first?
I'm happy to start. I'm happy to start.
So yes, definitely yes. We tend to see different skin types. We have a slightly different, more prevalence of pigmentation. For example, whiter skin types, you're going to be looking more at probably solar lentigo, which means it's pigmentation coming from sun exposure. When we talk at darker skin type, we have a lot of pigmentation around the eyes. We see more what we call post-inflammatory pigmentation, causing by injuries to the skin, anything that is inflammation to the skin, cuts, picking spots, all of those things. Melasma, for example, is more common on Fitzpatrick's 3 and 4. So there's a lot of different types of hyperpigmentation, and we tend to see, depending on the skin type, different prevalences of that pigmentation. I don't know if you, Maria and Sarah, you see the same in your clinics.
Definitely. I mean,
definitely, absolutely.
Sorry, I don't know who wants to go, but yeah, I'll go at this point. Just in regards to certainly post-inflammatory hyperpigmentation, I think is very, you know, particularly common in the Fitzpatrick 4 to 6s, you know, and that's something I see quite a lot of, particularly because we do a lot of hair removal as well around electrolysis, and people have either been really badly treated with electrolysis or actually just been over excessively plucking their hairs for a long time as well. Can cause a lot of post-inflammatory hyperpigmentation, because it can cause a lot of irritation to the skin. And obviously ingrowing hairs is obviously a big problem as well, as is obviously acne. All those types of things, I mean, can massively cause a problem with post-inflammatory hyperpigmentation, particularly, as I say, in those darker skin types.
I'll just give you a little fact there. Apparently 60% of skin of colour suffer with PIH. So, you know, it is a huge issue that, you know, we can help address, really.
Mm. Yeah, no, I think that's really interesting. And obviously, what are the most common causes of hyperpigmentation? And are there any that you think clients and therapists alike might not necessarily be aware of?
Well, obviously the sun is a huge one, UV damage. I mean, what we mentioned at the very beginning, that your skin has a natural defense. This is a natural defense. This is your tanning mechanism. But obviously you still need to protect your skin, because every time your skin gets tanned, it's getting damaged. So it does need a layer of protection there. So we'd be looking at UVB, UVA protection with a broad spectrum SPF. But yeah, as we mentioned, we touched on hormones already with pregnancy. Also, to add to that, you look at the oral contraceptive as well. So that's what gives that melasma, that veil, the pregnancy veil across the face. Medical conditions, I'll let Raquel talk about those a little bit more in a moment, and medications. And we've touched on the trauma already, which can lead to PIH.
Raquel?
Yeah, so genetic, like I mentioned, especially periorbital and perioral, it's very common that we see a genetic pattern to it, especially Asian skin types. Definitely medication, things like tetracycline, antibiotics, naproxen, which is an anti-inflammatory that is very, very commonly used nowadays for osteoarthritis and any inflammatory conditions. Also psychotics, so it's another photosensitive agent. There's actually an antifungal as well that causes sensitivity, and Addison's disease is one of the ones that we know that the skin is more prone to have hyperpigmentation. So it is very important that we do a thorough consultation, find out about all these medical prescription drugs, and also some warts as a herbal one, isn't it? So yes, St. John's words. It's very important to go through very thoroughly on that consultation to find out all of these things, because we can actually make it worse.
And Sarah, do you have anything to add?
Yeah, my thing, because I have such a big thing, a massive passion about the fact that it's not just about, obviously, you know, we've got to consider these HEV lights. We've been sat on the computer for the last year, you know, in front of our computer lights all the time. So UVA is massively prevalent there, the high energy visible lights. And as Maria, you know, greatly touched on, you know, I think we forget that, and it's all very well and good protecting our skin in the summer, but actually I think a lot of aging and pigmentation as well will come about from the high energy visible lights that actually get absorbed into our skin much deeper than UVB. So it's something that I'm massively passionate about, making sure that we are protecting when we're on computers and things as well.
Yeah, I think probably there's lots of people who aren't necessarily thinking about that at the moment.
Yeah.
But like you say, they've been in front of their computer for a year now, so myself included. And obviously treating hyperpigmentation for clients in salon is like really important. Does the treatment need to be tailored depending on the client's skin type? And if so, what are the key things that therapists need to be aware of? I don't know if you want to go first, Sarah.
Right, yes, I mean, yes and no with this one. Obviously, it does depend on what we're looking at. And when we're talking about the different skin colours, I mean, there are different treatments which will respond differently. So it depends on what we're looking at. So ultimately, we need tyrosinase inhibitors, for example, across the board. It doesn't matter what skin colour they are, whether a Fitzpatrick 1 or they're a Fitzpatrick 6, you know, we will need to put tyrosinase inhibitors, which I'm sure we'll be sharing some ideas and ingredients on. But we, you know, and that's the tyrosinase is the enzyme which actually increases the melanin production. So it's really important that we tame that. So we need certain ingredients to put into that. But I mean, not as the three of us, I mean, I touched on a little bit of laser and IPL, for example, because obviously it's very important, I think, to look at the higher Fitzpatrick colours when we're looking at sort of laser and more sort of ablative treatments, because of the fact that pigmentation can be absorbed and it's not sort of selective. So if you are going to be treating it for pigmentation, it's better if it's just on a spot of pigmentation, because obviously you might be able to cover over the rest of the skin, but to actually just over treat on the whole area can actually be really, really dangerous, particularly with the ablative lasers. So, you know, the gentler form of IPL may be preferable, but it's not, with the three of us have discussed this, it wouldn't be our treatments of choice actually in regards to the line we would go down, and I'm sure I can leave the others to explain more about our treatments of choice. But yeah, I think certainly in regards to ingredients, I think that we will put into the skin, then it doesn't really matter what the skin colouring is in particular. But obviously there are other factors we would need to take into consideration. If they had active acne, for example, and pigmentation, I wouldn't want to be putting a tyrosinase inhibitor such as vitamin C on the skin, for example, because vitamin C can aggravate acne. So there's all sorts of things that we need to take into the equation, and that's why it's so important about seeing a skin professional.
Yeah. And Raquel?
Yes, I agree with Sarah. Laser, although I'm not even close to a specialist in laser, I would say it's a very, very fine line, and it can actually cause long-lasting, delayed post-inflammatory pigmentation. So will definitely not be my go-to treatment. I actually prefer at-home drugs or prescription skincare to tackle pigmentation, and then make that work for 2 or 3 months, and then if we can't see a shift, maybe then start introducing other treatments in clinic. But my preferred approach for pigmentation is like Sarah discussed, the tyrosine inhibitors, sun protection, obviously, vitamin C if they can, and you know, wear hats, all of those things to help to protect from it getting worse.
And Maria?
So going back to the basics on this, I wouldn't touch any skin for any advanced kind of treatments in clinic without a healthy, balanced skin. So I would be looking at their lifestyle, at their home care routine initially, and putting together a program to bring the skin to have strong integrity, basically. And then if we are going to go on and do some clinical treatment, we'd be looking at prepping the skin properly. So obviously we've mentioned the tyrosinase inhibitors there, and the prevention, creating that umbrella over the skin with the SPF. And then we need to look at some kind of exfoliation to shatter that pigment. Now there's lots of different methodologies for shattering that pigment. You've touched on laser there, and going the non-ablative route. My personal preference is to work with chemical peels and with microneedling, because we don't get, well, we can use it across the board, basically, as long as we get our preparation times right. The reasons we work with the prep time is we need a nice hydrated skin, so recovery time is going to be minimalized. And that way we're not going to hinder any results in any way. But I think what people need to be aware is there is no quick fix to addressing hyperpigmentation. You know, it's taken a long time for that confusion in the cells to happen, and you've kind of got to unwind it, and you'll never be free of it. You're always going to be prone to it. So people need to be invested in their skin and the process. We again, within the Skin Collaborative, we touch on people and wanting quick fixes, and a lot of the skin issues out there, including hyperpigmentation, there are no quick fixes. You do have to be invested in, you know, the whole regimen, really, and you need to think from the very beginning how committed you want to be to the process. Do you want to be looking at in-salon treatments? Do you want to be looking at at-home treatments? And we can tailor things according to your lifestyle, according to your budget, and according to the problems and the symptoms that you have there.
And obviously you spoke about treatments that are really effective. So you've spoken about laser and chemical peels and microneedling. Are there any treatments that you don't think aren't that great for hyperpigmentation that maybe therapists should sort of steer away from? Or, you know, is there anything that doesn't necessarily work on it?
Personally, I'll probably get a shot here. I'm not a fan of things like microdermabrasion. I think they're too ablative again. I think we run the risk of trying to create a quick fix, and actually, as Raquel said, what then happens later on is you start to see PIH, and long term you've created more harm than good.
And what about you, Raquel?
Yeah, I 100%. And one thing is just to touch upon, just to add a little bit what Maria just said before. People are not aware that when it comes to hyperpigmentation, it actually takes, in general, on average, about 12 months to reprogram the melanocytes, which is the cells that produce melanin. So to re-educate them not to produce as much melanin. So you will have, if whoever is looking at improve hyperpigmentation, is a year thing. The program, it's going to be a long program, and like Maria said, you're going to have to always to maintain it. So it's something that you're going to have forever. And I know forever is a very strong word, but in this case, unfortunately, is forever.
I think it's, I didn't know that it takes a year. So I think that's really interesting. And I guess that's some of the information you need to pass on to clients to kind of manage their expectations, because I guess that's a really big part of treating clients, is making sure that they have more kind of reasonable expectations of what the treatment outcomes are going to be. How do you manage that as therapists? Obviously, clients want to come in and I guess they're hoping for like a quick fix solution.
Again, it's a good consultation, right? It's the good consultation is explaining the science behind it. And the other thing that people are not aware, and that it's important to mention, is with 2 or 3 days of unprotected UV radiation, if you don't put your SPF for 2 or 3 days and you go for Mexico for holidays, that's it. You undone everything that you have done for a whole year. So that's why it's super important. And that's why Maria said, patients have to be committed. If they're not committed, if they're not going to use the SPF, if they're not going to use your tyrosine inhibitors, there's no point of doing chemical peels, microneedling, anything in clinic, because you're fighting against it all the time. Yeah, I don't know. I'm sure Sarah will agree.
Oh, we've all had clients who say they're doing the job, and you know damn well they're not doing the job. You know, you can see that the pigment's not shifting because they're not wearing their SPF, they're not topping up their SPF, they're not doing their bit, and it is a partnership.
And what about you, Sarah?
I absolutely agree with what Raquel and Maria says. There's not really that much I can add to that one. I mean, absolutely agree of not over-ablating the skin, you know, and that's the point, because the whole structure of the skin is held together by rep pegs anyway. And if you actually over treat that, then I think, you know, long term, short term you can get some great results, but long term then it can cause some serious damage. So but yeah, I might get, again, like Maria, I might get shot down in flames by those who love microdermabrasion as a treatment out there. But I think it's much better to go for a more of a gentler chemical peel, sort of gently exfoliating, and building those peels up is really important as well, you know, not just going straight in. You know, I do work with certain brands, and we're not talking about brands today obviously, but even when we go in for a deeper peel for aiming to get rid of the pigmentation quite quickly, like Maria says, we would always prep the skin very thoroughly, firstly at home, and also with, you know, sort of more superficial peels in the first place within the clinic before we would move on to anything deeper.
I think it's really interesting. Oh, sorry, you go.
Sorry, Amanda. No, I was just say, I think it would be interesting as well to explain what your thoughts are on the microneedling side of things, because we do know that. And I just remember that because Sarah was just talking about going aggressive to start with, is before we used to treat pigmentation with the microneedling with much deeper depth that we do nowadays. And like Sarah said, you know, we have to be gentle. We don't want to cause that injury to the skin to cause even more problems. So actually with microneedling, what I tend to do when I treat for hyperpigmentation will be 0.5 is because we don't want to stimulate that basal cell too much, so it doesn't cause any more pigmentation.
Yeah, no, that's really interesting. And I think that's true as well, because I guess as well, some clients who have hyperpigmentation, they might be a little bit nervous about some of these more advanced treatments anyway as well. So I guess a gentler approach from the start might be better anyway.
Yeah, I mean, if you can get a result from a gentle treatment, then long term the skin is going to, it's not going to have any adverse effects in the same way. So always try the gentler approach first. As Sarah says, you're building up a tolerance anyway, you're testing the skin. You can still do a patch test on a skin and have a reaction. So just tease the skin along, and all you're doing with pigmentation is agitating, you're exfoliating and letting it come up to the surface, taking off that top, come up to the surface, take off the top. So you can do that in a very gentle fashion, and that's what we mean about quick fixes. You're going to have to go very deep and very harsh to get a quick fix. It's not worth it.
And obviously we spoke a little bit earlier about kind of the importance of using the right ingredients as well. What are the best ingredients you guys recommend for treating hyperpigmentation in salon, and what ingredients should you be looking to recommend clients to use at home to keep up the results? Maybe you go first, Sarah?
It's always who wants to go first? Yeah, I mean, there's loads. I mean, there are so many ingredients to look out for, and I know that Raquel's going to share her medical expertise on hydroquinone shortly, because that's not, that's much more of a medical grade ingredient. But obviously there's things like kojic acids, I can never say it actually, tranexamic acids, arbutin, vitamin C, really is L-ascorbic acid. Licorice root is absolutely brilliant as well, azelaic acids. But then obviously you've got your AHAs, your glycolics, your lactic acids, your mandelics, and things like that as well. Niacinamide has actually been really shown to actually help to regulate pigmentation, not necessarily as a tyrosine inhibitor as such, but actually it's just a great ingredient for regulating. Because vitamin A is I love vitamin A, so it's a good, it's because it's such a good skin normalizer. So vitamin A is brilliant. And then you've got obviously things like green tea extracts. There's so many things which I'm sure the other ladies will expand on shortly as well. But yeah, those are the main ingredients that I would certainly be looking out for in my skincare brands.
Brilliant. And what about you, Maria?
Well, yeah, pretty much all of those covered off from my mind. I know that Raquel is going to come on to hydroquinone, and I wanted to talk a little bit about two other ingredients out there at the moment. One is Synovia HR, and as we've mentioned before, hydroquinone does have you can't use it long term. So Synovia H4 is one to look out for, in that clinical studies are showing that it is 4 times more effective than hydroquinone without the downtime. So that's one to watch. And also for those who are sensitive to retinol, you can look at Bacachol. It has similar effects to retinol, again, without the downtime. So, if we're looking at being kind to the skin barrier, maybe these are ingredients to look out for in the future.
Brilliant. And Raquel?
Right, hydroquinone. It's a love-hate relationship, hydroquinone. We do know that with hydroquinone, it's you can use it long term, and there's not really a lot of studies also showing if there is other cytotoxic problems with it. So I only use hydroquinone last result, never more than 4% anyway, because it has been proven that if it's more than 4%, then that's when the problems really start happening, and we actually can cause depigmentation on the skin, which we can't really solve after that. So if it's completely depigmented, then that's it. And especially in higher Fitzpatricks, you can imagine how stressful that would be. So when using hydroquinone, really, really careful, never more than 5 months, never more than 4%, and making sure you follow that patient up very, very closely. Actually, hydroquinone is not my preferred one. So there is something called cysteamide, which is also a tyrosinase inhibitor with no downtime. You can use it long term, and I really, really love it. So obviously, all the others have been touched upon. This is the only one that Sarah and Maria didn't mention, and I use on a regular basis in my practice. That doesn't need prescription. So it's a very, very good one to look out for.
Brilliant. And I know we touched on a little bit earlier about kind of lifestyle habits, and obviously SPF is like a massive thing that clients need to get into doing. But is there anything else that they sort of need to take into consideration when you're treating their hyperpigmentation? Obviously, we spoke a little bit earlier about picking as well, which I imagine is something that you guys must see a lot.
Absolutely, lifestyle is key, really. I mean, if you're serious about not having hyperpigmentation and it's been caused by the sun in the first place, stay out of the sun. It's not just enough to have an SPF on. If it's a bright sunny day, stay in the shade or don't go out at all, really, if you can help it. And considering also your hats, your sunglasses. I see an awful lot of hyperpigmentation just to the side of the eyes where the glasses stop. People tend to not bring their sun protection close to the eyes because it can water into the eyes. And then we get terrible little patching coming there. So top tip there is make sure you have your SPF there, or you have wraparound glasses, really. Great big hat, and stay out of the sun as much as you can. Yeah, and know your triggers would be my other one. If you know you are susceptible to oral contraceptives, then maybe find another contraceptive methodology.
Yeah. And what about you, Raquel?
Very interesting. And one thing that I see in my patients, they actually forget to put SPF on the eyelids. So very important, don't forget your eyelids. The other problem that I come across very often is, what do I do? Do you want me to reapply SPF after my makeup? How do I do this? So my top tip for that is powder SPF. I use a powder blush thing. It looks like it has a brush and everything. There's different makeup brands. Make sure it's a physical one. It's also very good if you have oily skin, because it's going to help to absorb that oiliness that we get on the T-zone throughout the day. So top tip for me there, it will be reapply your SPF with this powder's SPF instead of just putting the cream on, and then run away from the sun, right, Maria?
100%.
And what about you, Sarah?
Again, I agree, actually. I mean, my main go-to is always a physical sort of mineral powder. It was interesting because when Raquel mentioned putting it on your eyelids, I know there's probably a lot of people who might be out there going, oh, well, I can't put it on my eyelids because it would, make my eyes sore, or it would run into my eyes, and it would make them really sensitive. And I've had that issue myself. And so mineral powder is just brilliant for that, because you can just put it directly over the eyelids. But I think one of my top tips, actually, and certainly in regards to sunscreens, is the fact that this is the problem, isn't it? People put it on in the morning and don't necessarily reapply. There are some quite good sprays now that you can actually spray over the top if you wanted to, or as Raquel said, actually just reapplying your powder. But ideally, an SPF should be actually reapplied to your skin every couple of hours. And I think that, minerals are slightly different because minerals will adhere to the skin longer, where a chemical SPF, or you can talk about the differences between mineral and chemical, but chemical SPF will absorb the sun's rays and sort of change it. And then after a couple of hours, it's just stopped working. Where minerals will adhere to the skin, but obviously if you touch your face, I tend to touch my face quite a lot, they're going to come off, it's going to come off quicker. So if you're a face toucher, then obviously you need to be touching up. If you've got a chemical SPF on, again, you do need to be putting that on more. But, then I open up another can of worms in regards to chemical SPFs, because there are some poor ingredients in regards to chemical SPFs, which, also could contain ingredients that could potentially pigment the skin. Just to open up another can of worms.
Yeah, I mean, that is a whole nother conversation, isn't it? Well, guys, they were all my questions for you, but we've had absolutely tons come through, so I'm going to try my absolute best to get through as many of them as we can. So thank you, everybody who's been commenting so far. The first question I was going to pose to you guys is it easier to treat pigmentation that's only been present for a few years? And will it take longer to treat pigmentation that's been on the skin for, say, 10 to 15 years?
Okay, I'm quite happy to pick this one. I mean, in regards to, it's not necessarily about how the length of time it's been there for, actually, it's about how deep the pigmentation is. So it becomes down to whether it's an epidermal pigmentation or a dermal pigmentation. So if it's in the epidermal layers, obviously it will be treated a lot quicker than it's in the dermis. And actually, it's not possible to really see that from physically looking at the skin. to know whether it's in the dermis or in the epidermis. Sometimes with the skin scanners, you can tell a lot more, but by looking at the skin, it's quite tricky to actually know whether it's definitely dermal or epidermal. So, which is why, as Raquel said earlier, it is a year-long process to actually re-educate the melanocytes. So yeah, I don't know if you guys agree with that, but I would say that it's not necessarily the length of time it's been there for; it's the type of pigmentation that it is.
100%.
Great. And we had another question as well, asking about what would be the best peel for pigmentation on a sensitive skin, Fitzpatrick 6.
Right, I can take that.
Yep.
I would probably, the gentler one was probably glycolic, 10%, something like that, and see how that goes. You can always enhance the percentage. Like we already said, all of this, we have to prep the skin, okay? I would probably try the glycolic. And you see, as the skin barrier function improves, the skin will become less sensitive. So then you can go and up and maybe do a Jesna pill, and then maybe you can go for the TCA afterwards.
Yes, Maria and Sarah.
Progressive, not aggressive. That's what I always say.
I totally agree. I might start with a lactic acid, but yeah, with the mind to building up. Again, it depends on the individual and the depth of that pigmentation. But yeah, this is where it's very difficult to give a generic answer, because obviously every skin is individual and we tailor to the individual skins. But yeah, definitely, I think the message is we would all start gentle and we would build up once the skin is prepped and once we've checked, its reactions.
And just to add to that, really, I agree with both Maria and Raquel. I would either go with a lactic or a glycolic. But I just wanted to share a little story in regards to a client who actually came to visit us in the clinic in the year or so before lockdown, who had actually been experimenting with home peels on a dark Fitzpatrick type, on Fitzpatrick 6, and had actually depigmented his skin, because obviously he hadn't prepped it. He'd been using, I think it was a TCA, it was either a TCA or a salicylic, I can't remember which one he was using, but he just bought it off the internet, and this is why obviously it's so important. And obviously no skin prep had actually done that, and then caused really massive patches of depigmentation over his skin. Whether that back, I don't know. He consulted us, but I think bless him, he was so worried. He was a university student, and he was so worried about what his mother was going to say to him. So I think his mother did sort of speak to him, and then after that we didn't see him, because I think it was a matter of just don't do anything, don't speak to anybody, just don't do anything at all. So he backed right off. But it was going to be a difficult one to try and help him anyway, because he'd really damaged his skin, and this is why it's the peels and doing it gently, especially on those darker Fitzpatrick types, is really imperative.
Yeah, gosh, and this is why you need to see a professional to get these things done. It's not worth the gamble.
I know this is all aimed at professionals here today anyway, so obviously everyone's encouraging people in, but I think it's important to share these stories.
Definitely. And we've had loads of questions about the best way to treat melasma on the face and on the body. Who would like to go first on that?
Well, obviously, once that hormonal stimulation has disappeared, the melasma will generally subside. I think that's important to remember, that it will actually, but because if set about this sort of preordained issue within the melanocytes, it can then be stimulated by sun moving forward, etc. So you would still need to practice what we've talked about in the home care with your tyrosinase inhibitors and your SPF for sure. But yeah, you kind of treat it in the same way, really. They're all hyperpigmentations. You might just treat the area as opposed to the whole face. Again, it depends on the issue. It depends on whether they've had it before. And any contraindications, etc. along the way. So yeah, again, it's hard to say generically how you would treat skin.
If I would just add to that, I think it's really important, more than in maybe any other pigmentation, to really explain the patient that this is the most difficult pigmentation to shift. So really managing their expectations is imperative here. And I have great results with systemide. You don't even have to go with hydroquinone and tetatoin. So yeah, having a good exfoliation and the systemide with the normal AHAs, they work really, really nicely. And I have good results just with that without prescription drugs.
And did you have anything you wanted to add, Sarah?
No, not particularly. As Maria said, I mean, obviously, lots of the time the triggers have to be removed, first before we can successfully treat. So I think, obviously, if they've still got the triggers, so for example, if they're still on the contraceptive pill, for example, and we know that that's possibly maybe their trigger, it would be very, we can try and give them some tyrosinase inhibitors, obviously, and we can help them as best we can. But as Raquel said, it's all about managing their expectations, working with that client, because you're not going to necessarily get as good a result on somebody who's got the trigger still in place. So it's important as much as possible to try and remove the trigger before we can start successfully trying to treat as much as we can.
And actually, there has been some studies about having oral vitamin A for help with pigmentation. So it would probably something that I would have a conversation and add that to their routine and have something orally, vitamin A. And something actually, I just remember that we're talking about oral vitamin A, because we're talking about pigmentation. We're going to be saying to our patients, run away from the sun. They probably are going to have a deficient in vitamin D as well. So it is very important to actually talk about supplementation of vitamin D in these patients. Living in the UK, we know we don't have a lot of sun, but even if you were in Brazil with sun every day, because you're going to be protecting your skin so much, you're not going to have that conversion. So I'll be definitely adding a vitamin D supplement to that.
Yeah.
And can I just add, I think that's really important, because we haven't really touched on the internal supplementation. We've really been talking about topical ingredients here, and internal supplementation is actually a vital part of any skin program, I feel, when you're looking, at the whole inside and out approach. So, and I would also be looking at other antioxidants as well as the vitamin A, and also adding in vitamin C in particular.
Definitely. I guess it's more of a 360 approach, isn't it?
Yeah.
It is to any skin health. It really is. Yeah.
There's been a few questions asking about what lasers you guys would be using in treatment on hyperpigmentation.
I personally don't use lasers, so I'm not equipped to answer that question, I'm afraid.
I'm the only one who we used a little bit. We use an IPL, but to be perfectly honest, it wouldn't be my go-to. As we discussed earlier, it wouldn't really be my go-to treatment for pigmentation. Really, I think we've got much better tools in our toolboxes than laser. So yeah, it's a tricky one on that one. Sorry, I can't answer that more thoroughly.
No, that's fine.
Same here. I apologize, but same here.
That's okay. And we had another question as well, was can the color of the pigmentation tell the depth of the pigmentation?
So if you get a suntan, obviously you're protecting your skin. If your overpigmented area keeps getting stimulated by UV radiation, it's going to get darker and darker and darker. Now, there is more prevalence of the eumelanin in the black skin, so that will appear darker on the surface of the skin. So it does have a little bit to do with your Fitzpatrick, but it also has to do with, if you're still getting that impact from the trauma or the trigger again and again and again. So again, every skin is different, but yes, I suppose is the answer.
And Sarah and Raquel, do you have anything to add to that?
No, sometimes we see as well a blue tinge or grey tinge to the area, and that will indicate different types of pigmentation. So it's actually a way of differentiating. But the scanners and the Wooden lamp, it will be the best way to tell you exactly which pigmentation it is. So I would never go just by looking. If I'm in doubt, I would go and get those gadgets to tell exactly what it is.
And we had another question as well about, can microneedling aggravate post-inflammatory hyperpigmentation because it sees it as an injury on the skin?
Yes, it can.
Certainly it can if you go too deep.
Yeah.
That's why we don't use any long needles anymore. I mean, the school of thought used to be that you needed to get deeper into the skin to get a bleed. That is not the case these days. We only need to agitate to shatter the pigment, so we can do that superficially.
Mm.
And Maria, would you say as well that you wouldn't recommend the hand microneedling for use at home for these patients? Because that's something that I'm quite passionate about, and I wouldn't recommend you microneedle your own skin.
Yeah, personally, I 100% agree. I like all these treatments to be kept in clinic, for the hygiene element. I don't like the idea of reusing these gadgets because, you know, you are opening up the skin. And you don't want to be passing any bacteria into the skin. Again, you're setting up a whole new set of problems. But yeah, there's a skill to microneedling. It might look easy, but it isn't easy. You know, if you're rollering, it's about having that consistent pressure. In fact, there's very little pressure at all. And if you go hell for leather on your skin in any way, then you are creating lots of issues. And my worry about that is then they're combining it with the other actives they've got in their toolkit, in their arsenal, and they're creating all sorts of impact to their barrier. And then they wonder why the problem is not going away.
Mm. Actually, that same person's just replied and has just added onto the question, how deep can you go with microneedling to prevent aggravating hyperpigmentation? Like, what would be the recommended depth?
Oh, I would only work at 0.5 millimeters now. I mean, that's changed. The school of thought has changed over the years, and it's very different from when I first trained to deal with hyperpigmentation. But yeah, 0.5.
Mm.
I don't know if the girls agree with that.
Yes.
Yeah, 0.5.
Absolutely.
And we had another question. Is melasma triggered by perimenopause?
It can be.
It can be, yeah. Again, it's a hormonal reaction.
Mm. And we had another question from Maria, and she says, white skin patches, is that deep epidermis skin damage?
Or vitiligo. So that's a hypopigmentation. So that's the opposite of what we're talking about. It's where your melanocytes are underproducing melanin for whatever that reason, vitiligo, albinism. As skin professionals, we don't treat that.
Mm. And
there's very little that can be done, and usually only dermatologists are equipped to try to deal with it, and even so, they're usually not very successful, to be honest with you. So that's why we need to be careful so we don't go the other way and depigment the skin, because when it's depigmented, that's very little that can be done.
Mm. And there's been a few questions sort of along the same lines, just asking, what do you think is the easiest type of pigmentation to actually effectively treat on the skin?
None of them are easy. None of them are easy.
Well, epidermal is obviously going to be easier than dermal pigmentation, without a doubt, because obviously it's in the upper layers, so we can get to those much more easily than the dermal pigmentation. But I mean, it depends whether they mean whether it's like melasma or lentigos or whatever. You know, it's that they're none of them, as the other ladies just said, none of them are easy. But definitely, epidermal pigmentation would be more successfully treated quicker than probably what dermal pigmentation, because we've got to work that bit up to the surface of the skin.
And something that I always say to my patient that I don't think we have mentioned here is we need to warn our patients that the pigmentation can actually get worse when we first start treating it, because exactly for what Sarah said, and that's what prompted me, is the pigmentation is coming up to the surface. So it will get worse before it gets better. So they don't panic and say, I'm spending money, you know, doing all these treatments, spending all this time looking after my skin, and it's actually getting worse instead of better. So it's important, again, manage patient expectations.
Yeah, definitely. Because I guess as well, you know, I guess that's probably the most common question that therapists get from clients is, how quickly can I see a result? So is it better with these kind of skin conditions to actually say, you know, it's a year-long journey and we have to progress, than necessarily saying, oh, in 3 months you might see some kind of difference?
Absolutely. And if they are fully committed and they're looking after their skin at home, they're doing everything they're told, and you know, they're showing up for the treatments and they're following the program, then obviously they're going to see that result and maintain that result. But obviously every skin is slightly different. You know, if it is just you know, a patch of solar lentigo, that's a very different scenario to dealing with a melasma. So again, each case is individualized and tailored accordingly.
I'd just like to add to that a little bit. Obviously, it is going to depend on the brand and the type of products that you're using on the skin as well, and how you're going to get that result slightly. Again, as I say, we're not here to mention brands, but there is one particular one that I work with, which we actually can get a very sort of quick result in clearing the skin of the pigmentation. But the whole point is, as we've already touched on, is that following that, it's a lot of aftercare that they have to carry on using to make sure that we are re-educating the melanocytes at all levels. So even though that we've actually got a fairly quick result in the beginning, if that was where it was left, then they wouldn't continue to get that quick result. It would come back again very quickly. So it's a matter of they have to then have a year-long program at home to make sure they are re-educating those melanocytes all the time, and you know, to actually get, hopefully, or at least to maintain and keep the result that they want to go forward into the future.
Can I just add to that, Sarah? So really what we're looking at is a three-pronged approach, and you really shouldn't be doing one without the other because it's like a pointless exercise.
Yeah.
So you are preventing, you are hindering. So you're preventing with your SPF, you're hindering with your tyrosinase inhibitors, and then you're exfoliating. Whether that's at home or whether that's in the clinic, that process needs to be part of that circle. And as I say, on any of those in isolation, it's pointless.
Can I also add something else? All of this has to be done with medical grade skincare.
Yes.
I don't think we have touched upon this. I don't know if the public is going to watch this at some point, or even other therapists are not sure which brand to go for. Always choose the medical grade skincare, because they are the ones that are going to have the correct concentrations. They're going to have the delivery systems to make these ingredients work. If it's not a medical grade skincare, all of the results we've been talking about, time frames and all that, you're probably not going to get the results because they're not up to scratch.
Yeah, I mean, are there any brands that you guys absolutely swear by for treating hyperpigmentation? Because I'm sure people would like to know your recommendations.
Well, we all work with different brands. I'm happy to. I work with DermaQuest, so I use their home care regimens for my clients. They have a range called Skin Bright, which is fantastic for prevention and maintenance. And then I work with their peels and their resurfacers for treatment. And obviously I've got my brands for my my derma rollers as well.
What about you, Sarah?
So I work with two brands. I work with Environ Skincare, and we get some brilliant results, even just with home care with that. I've actually treated my own skin for pigmentation over a year just with Environ Home Care. But I mean, the one I will always rave about is Mesoesthetics Cosmelan. So that's you know, that's our other brand is Mesoesthetic, and we just have some absolutely awesome results with the Cosmelan treatment. And
what about you, Raquel?
I work with several brands. I work with Illumi MD, Zedo from Abaci, Zenobaci, and I love Cispera for pigmentation. Every single patient that will come to me, even if they are on the other brands doing the program, Cispera always comes along, because Cispera is like, it's a treatment that you do 15 minutes before you do all of your skincare. So yeah, for me, Cispera is the go-to for any patient, and then all the others I will tailor to their needs.
Well, I just want to say we've pretty much nearly running out of time, so I just want to say a massive thank you to the three of you for today. It's been really, really interesting and enlightening, and we've had so many lovely comments on Facebook and stuff from people just saying it's been really informative, really educational, agreeing with so much of what you've said as well. So I hope that we've been able to answer as many questions from people as possible, and I'm sure we'll get you guys back doing something with us in the future as well. But yeah, I just wanted to say a big thank you from Team PB. And obviously, if anybody's watching this and they came in late or they want to watch it again, as soon as this live is finished, you'll be able to watch this on PB's Facebook page in your own time. We'll be putting it on our IGTV this afternoon, and we'll also be loading it up to our YouTube channel as well. So you can go back at any time and kind of dip back into the bits where you want to re-listen to. But thank you so much, Raquel, Maria and Sarah. Really appreciate it. And yeah, and guys, check out the Skin Collaborative. It's a really, really great initiative. Go check out the platform. But yeah, thank you so much, guys. Really appreciate it.
Thank you for having us.
Thank you.
for
Thank you
having
very
us
much.
on.
Bye, everyone.
Thank you so much.
Thank you.
Bye-bye.